Hello and welcome to Midwife Dave. As you know, that's my nickname because no one can say my actual name, which is Piroshka. Right, so in the series of videos that I'm doing, today I'd like to talk to you about induction of labour. Now, induction of labour is very, very, very common here in the UK. And there are different methods for the induction of labour and different reasons for the induction of labour. Now, one of the problems we have is that for some reason, lots of women think that they get uncomfortable near the end of pregnancy. Yeah, it's hot, it's sweaty, your joints ache a little bit, it's hard work. And unfortunately, a lot of women are seeing induction of labour as the easy way out. So they ask to be induced. All right, so I'm going to tell you what it's really like. Induction of labour is great if you're term plus 2 weeks. That's generally our guideline here in the UK. We don't like you to go any further than that because evidence suggests that the placenta doesn't function as well as it should, and that can be quite dangerous for the baby. So at that point, that is, what we would consider, the most valid reason for an induction of labour, unless you have any complications in your pregnancy. Now, remember, most of these videos are for you if you're a low risk, straightforward pregnancy. So the induction of labour could be because you are high risk. It could be because you're just post dates. And as I said, some people request it for other reasons. But it's important you understand the process of induction before you decide for that as an easy option, because it isn't, if you have no other reason for having it. So, induction of labour, there are several methods. What will happen when you are booked in for an induction of labour, you'll be invited into the unit. So you'll come into the hospital, onto the ward, you'll be popped on a monitor, okay, and that will be for about an hour because they want to assess baby's movements and well-being and see if you're having any tightenings anyway, because if you're post-date you may well start to be an early neighbour and not be aware of it. Once they've popped you on the monitor for an hour, they'll examine you vaginally, and this will be generally the midwife, and she will examine your vagina and find your cervix and try and discover if your cervix is dilated at all, or if it's in a good position. If it's possible, if it has dilated at all, we'll be assessing whether we could actually break your waters instead of using maybe something else. Based on what we find, how dilated the cervix is, whether it's soft or firm, what position it's in, an assessment will then be made as to what we're going to use to start your labour. Generally, we have two options. We have a pessary, which is like a tiny little flat tablet in a little tiny stocking. It's about the size of my little fingernail and it's flat. And that is popped into the vagina. We try and get it behind the cervix. So if you can imagine the cervix is sort of here, we pop it in behind. And what that does is to try and soften the cervix, because actually no one's absolutely sure how you start labour, okay, but we know it's something to do with the cervix softening. They call it ripening, which is slightly unusual, I know, but it softens and then it starts to open up and shrink up. All right, if you want to check out my latent phase video, that'll tell you more about that. So we have that. We also have a gel, which it comes in a syringe, no needle, you'll be glad to know. And literally we just squeeze the syringe and the gel goes into the vagina around the cervix, and it does pretty much the same thing. Now that can be used if your waters have broken, but you're not contracting. Okay, so we can use that then. Sometimes what they'll do is, if your waters can be broken, they will just break your waters and leave you for a couple of hours, see if you get going by yourself. If you don't, then they will want to put up a drip, which is a synthetic hormone. You have to have a line in, okay, and that's measured out very, very, very carefully. That will be done on labour ward, and that's done very carefully, and you're monitored, and we see if we can start your contractions and increase them to a point where they're effective. Now, all sounds very straightforward. The other thing you need to know is whether you have the little pessary, the little flat tablet, or the gel. You will be monitored at a 6-hourly period. This can vary from unit to unit. Everyone has their different guidelines, remember. So you'll be monitored every 6-hourly. The little flat tablet stays in for 24 hours, unless you go into labour. The gel, we reassess you after 6 hours. Okay. Now, it is possible that nothing will happen. So you will have spent an entire day and night in hospital and nothing's happening. And they may offer to repeat that process again. So here we go. Okay, you're going to do it again. Or it may be that if you have had the flat tablet in, that now your cervix has opened and they're able to break your waters. So they may then do that. Okay. If you're having the Prostin gel, then they'll reassess you after 6 hours. You may have a second gel put in. Again, the hope is that we're going to be able to break your waters and get you into labour. Now, sometimes that works. Some people react really quickly and the pessary or the gel goes in and within a couple of hours it's started to happen. For some people, it doesn't happen at all. So we have a lot of processes that we can go through. It can be quite a lengthy process, quite long-winded. People get a bit fed up because they're in hospital and nothing's happening. It's very difficult to sleep in hospital when you've got lots of people around you, okay? It can also make you tired then when you do go into labour because you've been in hospital for a long time. So do consider very carefully if you're a low-risk pregnancy. Consider the options carefully if you feel that you're at that point where you just want the baby out and you want an induction, because it doesn't happen immediately. Okay. Sometimes it doesn't happen at all. All right, and so then we have to reconsider our options. There is the chance that you will end up with a section because we just can't switch your body on. What we're trying to do is switch on a body that's saying, well, I'm not ready yet, the baby's not quite ready. That's what we're doing when we're inducing you. The other things to remember is when you come onto the unit, if you are low risk, even if you're post-dates, you're still low risk, we're starting the process. If the unit is extremely busy on the labour ward and they're full and they don't have enough midwives to take you, they may well delay the induction process because we need to make sure that the unit is safe before we can then be ready to accept you on the labour ward. What we need to avoid is lots of ladies going into labour at the same time and there not being enough of us to look after you. So just be aware that the induction process can take a very long time and it can take several days. It's not always going to happen immediately. So what are you going to do about that? Okay, so if you need to be induced, it's got to happen, you've been told it's going to happen, prepare yourself. Make sure you've got supplies. Don't bring so much stuff that we can't get near the bed, but, make sure you've got your TV card for the bedside TVs if they've got them. Bring your iPhone, your iPad, so you've got lots of things to distract yourself, all right? Make sure you've got lots of snacks, lots of magazines, okay? Go for a walk. Don't stay at the bedside the whole time because it will drive you nuts, okay? Pop back for your monitoring and your observations, as you're instructed to do, and that way you can make it a more bearable experience and try and balance your wandering around with having a rest, okay? And that's how you're going to get through it. And stay positive, all right? Stay positive, that's really important. Remember, what we're trying to do is switch on that body, and we're there to help you, okay? All right, so that is induction of labour.